Good afternoon and welcome to This Week in Digital Health. I am your host, Mike Doherty, and we're here today with Ed LaHood from MedReality. Ed, what's going on?
Oh, Mike, good to talk to you today, man. Thank you. We're doing a lot of cool stuff. I'd love to tell you about it.
Well, we're on a video, so you should, by all means.
Yes, of course. No. So I can tell you. So our company is actually called Thyng, spelled T-H-Y-N-G.
Okay.
Started the company about 7 years ago, and we're really focusing on creating amazing kind of 3D visualization, augmented reality, virtual reality solutions for the medical arena. And so our medical brand is called MedReality, and it's so exciting because in general, the medical community is amazing, and really there is a huge opportunity in the medical community to start to introduce all of these new technologies. People hear about artificial intelligence in medicine, which is fantastic. But really now there is an incredible opportunity to start to use all kinds of 3D visualization within medicine. And it could be 3D visualization, looking at a 3D object and manipulating it within your web browser. It could be looking at a 3D object in virtual reality on an Oculus, or in augmented reality on a Hololens, or even in augmented reality on an iPhone, a standard iPhone. And the beautiful thing is that there's an opportunity to really change medicine and to save lives. Because when you think about when somebody goes in for, and this is what we're doing a lot of, somebody goes in for a CT scan or an MRI scan, oftentimes the doctors, the radiologists, the physicians, they're still looking at those scans like they've done for years, meaning they're looking at black and white slices of a CT scan that was taken maybe of your chest area, or of an MRI scan, which is great. And many of the physicians were taught to read film that way. Mm-hmm. But these days we have a whole new level of technology, which is incredible, where we can take 600 slices from a CT scan, so 600 black and white images, and we can convert them into a beautiful, fully textured, full color, three-dimensional model of one of your body parts. So a model of your heart, or a beautiful 3D model of your spine, or, God forbid, a model of a spine with a tumor around it. And it gives physicians, radiologists, surgeons, clinicians of all types a whole new way to look at and understand what's going on inside of your body. So in the case of a complex tumor that may be wrapped around a spine, they can now look at it in 3D on their iPhone or in their web browser and see exactly what's going on with that tumor and understand the best way to approach surgery, allow clinicians to collaborate on what's happening, allow patients to have a better understanding of what's going on inside their body so they can see it. And so we're putting together a platform that really, we're calling it kind of the last mile of 3D visualization for medicine, where radiologists, physicians can now take this, previously, black and white 600 slices of a CT scan and now visualize it in full 3D on any device, anywhere in the world. And that's really kind of the core vision of the MedReality platform. And now what we're doing, which is also amazing, in order to introduce this technology to everyone, including physicians, including patients, including educators at whether they're medical schools, at universities, introduce this to researchers. What we're doing is we've started a marketplace that we call the MedReality Marketplace. And the marketplace is going to focus on having 3D models, this is fantastic, 3D models of real anatomies from real people that show real medical cases. Some of them may be healthy, some of them may be abnormal or diseased, but the whole idea is to have a marketplace of incredible real world 3D anatomies that allow people to learn, to understand, to be able to, whether they're physicians, whether they're students, whether they're researchers, or whether they're patients, to really allow folks to have a broader, better, more complete understanding of what's going on inside their body. And the first model that we launched the MedReality Marketplace with is an incredible model. It's a model of a 3D model of an actual COVID lung. So it's a set of lungs that have been infected with COVID. And this is the first 3D model that's downloadable of a COVID lung in the world. Some folks have seen pictures of a COVID lung, maybe in a magazine. This is the first one that everyone can download. And it's from a real patient. It's from day 9 of their COVID infection. This patient actually ended up going on a ventilator 3 days after this model was created. And what's incredible is you can see with this model, and now everyone can see this because it's right there in front of you in beautiful color and beautiful 3D. You don't have to be a physician to understand or to be trained as a physician to understand what's going on. You can see this amazing set of lungs. And then within the set of lungs, you can see all of the pockets of fluid that have developed in the lungs as a result of the COVID infection. And typically COVID, when it attacks your lungs, it starts to attack in the lower lobes of the lungs, on the periphery of the lungs. And you can see all of those classic kind of signs of COVID in this 3D model of COVID infected lungs. So you see healthy lung tissue, but then you see these incredible and really startling pockets of COVID infection all throughout the periphery of the lungs. The lower lobes of the lungs are full. You see pockets of COVID infection starting to kind of form around all of the bronchi within the lungs, the areas of the lungs that kind of distribute the air and distribute the blood. And so it's amazing to see. And it's part of kind of our whole mission to be able to educate the world on, of course, 3D and 3D visualization, but now use 3D and 3D visualization as a tool to really educate the world on many of these areas of medicine that have, before now kind of been a mystery, and to kind of take the covers off that mystery, to really show people what's happening inside of their body in many different types of medical cases. Show it to them in true 3D that you can see in your web browser, see on your iPhone, see anywhere, and allow people to understand what these kinds of, medical situations entail, but also kind of to introduce them to this new technology that allows them to easily view and understand all of these types of medical situations.
And in my understanding, the good news is this patient has since recovered, right?
Thank God, yes.
Yeah, so that's the good news.
Has since recovered. That's the good news.
That's exactly the good news. I wouldn't say the bad news, but the dramatic, I took a look at it, and the dramatic impact is it looks like somewhere between 50 and 60% of the lung has been impacted by COVID. So, I mean, it's right. The visualization is quite dramatic because you can see how pervasive it was.
That was our sense exactly. When we first saw this model, we were floored because I think everyone has kind of this understanding, okay, yes, COVID can impact your lungs, but I don't think everyone really realizes the extent that COVID impacts your lungs. And when they say COVID can, attack fast and that your health can change very quickly, I think this is the perfect illustration of that, because exactly as you said, you look at it and you're like, oh my gosh, this has literally impacted 50 to 60% of their lungs. And when you think about it, when you think about the impact that has on your ability to breathe and oxygenate your body, that's the startling impact that COVID has. And I think this visualization brings it to life better than anything else we could imagine.
So let me ask you a couple of questions. What do the radiologists think of this? Is this threatening to them? Is this a good thing or a bad thing? What's their opinion?
The radiologists love it, and the radiologists are embracing it because I'll tell you, and for lots of reasons. And we're working with a lot of great radiologists on many fronts, on helping develop the technology, on helping distribute and roll out the technology. And for many years, the radiologists have great tools at their disposal. They have incredible, machinery, CTs and MRIs. Radiologists have workstations at their disposal that allow them to visualize these CT scans as they come off the CT and MRI machines. But one of the things that I think radiologists for many years have struggled with is that part of what a radiologist needs to do is they need to be able to convey this information to other folks within the hospital. They need to be able to convey this information to other physicians, to surgeons, to patients, to staff, to folks at other hospitals. And I think many radiologists have seen this as a challenge, meaning how do they, first of all, how do they get the information from their workstation to the physician or the patient? And then two, how do they put the information into a form that's easily understandable by the physicians or the patients? And many physicians are pretty adept at, reading a single X-ray. They can say, oh yeah, that bone is broken. But it becomes more complicated when it's a case like a tumor wrapped around your spine, where you really need to have multiple simultaneous angles on that visual in order to really understand it. So the bottom line is that the radiologists are embracing this technology because it gives them a way to both distribute the knowledge they need to distribute and then also put the knowledge into a form that's easily understandable by anyone outside of the radiology suite.
And I know one of the things is the challenge in radiology is sort of the bottleneck, right? Someone needs to be available, someone needs to be able to do the scans and then read them, and then somebody has to walk them over to, the doctor. So there's this whole delay. How will this impact the, are we able to get beyond the data silos and actually see things in real time?
That's the goal, and that's really what we're working on, kind of day in and day out, is the ability, not just to distribute this anywhere, not just to distribute it in a form that is easily understandable, but to be able to do it immediately, so that there is all of these delays based on the old workflows, whatever those workflows may have been. Those delays now can also be overcome, and that's part of the beauty of what we're doing, is that because there is, everything is digital and distributed digitally, and obviously converted to this optimum digital form, there is this, immediacy about what we're doing, which is kind of, amongst everything else, a huge kind of component of this that makes it very attractive.
And can we use existing technologies to capture the images, or do we need new technologies to support this?
Well, that's like the best question. That's a great question. And one of the other things that we've been doing, working on very hard, is understanding how we can insert this technology into existing workflows using existing hardware, existing workstations, and allow this technology to plug right in so that it becomes, easy to go, out of the current radiology, hardware / software into what we're doing. And so we've really spent a lot of time structuring that so that we can slip right in and do exactly as you said, use existing hardware, use existing, software, use existing workstations, and slip this technology in so that the use of it becomes seamless. And we're doing a lot of interesting things on that front. But yes, that's exactly what we're focusing on. That's right.
And how are the big image players responding to this? Is it, does this make you an acquisition target? Are they trying to reverse engineer it? What's going on?
Well, more of probably the first, because
okay, good.
More of really the first, and we've not to say too much, we talked to all of them. We've partnered with some of them. We're partnering with some of them, and what's interesting is there's a few big players that make kind of the big iron, the big CT scanners and the big MRI scanners. Right. And interestingly, and that's a great business for them, of course. But they are always looking, obviously, for new angles to sell more equipment, but also new angles to take what comes out of their existing equipment and make it better. Because if we can do that, then that helps them sell more equipment. And it
prolongs the life of the equipment too, right?
It prolongs the life of the equipment. It prolongs the utility of the equipment. And so they look at what we're doing as kind of like a godsend. They don't look at it, it's not competition. It's an augmentation, basically, that allows everything that they're producing to now be used in a whole new way. And so everything that we're doing is really, an amazing positive catalyst to the big equipment makers, to the CT makers, the MRI makers, for all of those reasons. And so they are, they're embracing this technology. And I think a lot of those companies are typically bigger companies, and typically in bigger companies, it's kind of harder to innovate as quickly as it is in smaller companies. So I think, in a lot of cases,
Thanks, management.
right. They look to the smaller companies,
Right.
For that innovation, whether it's through partnership or through whatever that relationship may be.
And the recipients, the doctors, the surgeons, all these type of people, are they open to this? Because they're not really known for, looking to embrace change. So they've been doing things for a long time. It seems to be working. Are they receptive to this?
And it's a great question, because you're right. In many cases, physicians, all things being equal, they would rather just keep doing things the same way. They're not interested in disrupting their workflow. If it works for them already, it's fine. And what's interesting is that everyone that sees this, everyone that starts to use it, wants to embrace it, because they realize that there is there is a significant tangible value that this brings, or multiple values that this brings. And so the caveat to what you said, which is true, that in general, all things being equal, physicians, don't want change. However, if there is something that can dramatically, save them time, or make them more efficient, or save money, or improve patient outcomes, save more patient lives, or help them even explain something better to a patient, where physicians, they tell me all the time, look, I spend 3/4 of my day explaining things to patients. If I can even make that process simpler, better, faster, that does me a world of good. And so when you marry that with all of the other advantages of improving patient outcomes and improved efficiencies, et cetera, when they see this and they understand the value proposition, they embrace it. And it, it goes beyond kind of the conventional wisdom of they don't want change. When they see this, they embrace it.
And then obviously the holy grail is, what do the payers think?
Yeah.
That was a question. What do the payers think?
What do the payers think? Well, no, and there's an entire kind of area of focus around that also. And obviously,
yeah, especially in the value-based care, right? Where, like you said, they want better outcomes. They want, less, rehospitalizations, greater efficiencies and less cost.
That's exactly right. That's exactly right. And there is, when you start to look at, the value proposition for technologies like this, and you start to understand, who pays for it? Does it increase revenues? Does it save money? What is kind of the financial model around using technology like this? There are many ways to look at it, and we are using all of those approaches. And granted, kind of, selling this based on all of those approaches. And I can touch on a few of them very quickly. And so, one model revolves around, and there's a lot of models, but obviously one model revolves around the recruitment and retention of patients. And obviously, when you start to look at utilizing this technology, you start to look at it from a patient perspective. And the idea is that oftentimes patients go into a hospital, they want to be made comfortable, they want to understand what's going on, they want to know that the hospital is on the forefront and the cutting edge. And many hospitals are embracing this technology for all the reasons that we talked about, but also for a very fiscal reason of, look, we can utilize this technology to show customers, show patients how advanced we are, which helps us with recruiting new patients, if they may use this technology in marketing to show the cool stuff they're doing, and also retaining patients, meaning hospitals may, if hospitals can get 1 or 2 or 3 new, patients a year with significant cases, that pays for this already. If they can retain 1 or 2 or 3 more patients a year because the patient sees that the hospital has this technology and that wows them and prevents them from going somewhere else, that covers the cost of this. So looking at it from that angle is one very interesting angle. Obviously, there's also the angle of looking at it from saving money and improving patient outcomes, which can be quantified. There's also the angle of, and this is the angle that's evolving pretty quickly, the angle of using billable codes to cover new technologies like this. And there are currently existing codes on the books that start to get into this area. For example, showing a 3D visualization to a patient on a device that is separate from the radiologist workstation. There's a code for that. And there's a lot of other work being done right now to embrace billable codes for everything from 3D printing to 3D visualization in all of its forms. And so as kind of the industry evolves very quickly, this technology is becoming more and more entrenched in all facets, including including the pay side.
I was on a panel the other day, and it was about talent acquisition. And one of the key points to the discussion was that, healthcare organizations, they need to be embracing the latest technologies, because that's actually very attractive to talent acquisition, right? They, if somebody is new out of school, they want to work for the company that's got the latest technology, right?
Huge. You're exactly right. And that's another big driver of this. And we deal with it every day as far as, look, hospitals are looking to recruit the new, the best, and the brightest. And clearly, in order to do that, the hospital needs to show that they're, really working with the latest technology to make themselves attractive to the best and brightest. So that's, man, you hit the nail on the head. That's exactly right.
And so when you released the COVID lung model, so in the process of this, when you developed this model, were you guys surprised? Were you like, oh my God, I can't believe we actually did it? Or, or you're far enough along that like, of course we did it? Well,
a combination, because, we were far enough along with this technology that we knew we could produce something that would be incredible, that would be eye-opening, that in many cases may be shocking, and we could create something that was inherently also in its own way, I hate to say the word beautiful, but it is beautiful in the sense that, look, you're actually able to see inside someone's body and see what's really going on. And I think we all knew that we could create something incredible, but I think as we kind of were going along the path and it was happening, we even had our own minds blown as far as, the impact that this model could have, as far as, the sheer quality of the model, both in, because we have multiple versions of the model that we include in the package. When someone downloads it, we have, textured versions of the model, which really give you kind of a view of how things really look. We have a transparent version of the model that allows you to see inside the lungs and even have a more dramatic view of where the COVID has impacted. And then we have separate versions of each of the components. So separate versions of the actual COVID infection, where you can just look at the model of the COVID and see how dramatic it is. And so we even, I love your question, because it's true, we even surprised ourselves as we were going through this process as to the impact of the model, as to in some ways the beauty of the model, and in our excitement to get the model out there and show the world. So yes, we knew it would be amazing, but it even blew away our own expectations.
And I know that I was looking at a video, so I wasn't able to control it, but I'm assuming that when you supply this model, the clinician will be able to control the rotation and stop it and look at certain areas if they want to focus on something.
Yes, Mike, thanks for asking. That's exactly right. And so when and that was also part of putting together the entire experience for this model and for other models on the MedReality marketplace. We wanted our customers and our users to be able to experience this model in many different ways and to make it as easy as possible for them to experience it. And so what we're doing is providing this model and making it available through many different experiences. So number one, users can actually download the full model and view it in any other kind of 3D software that's out there that they may use for any other purposes, 3D printing or anything. But the easiest way to view the model is right after you get it, you can view it within the web browser, and you can go back to that. So you can take any of the 9 models that come in the package, and we have an incredible live 3D web viewer that runs in a web browser, and you can, move it, manipulate it, turn it any direction you want, zoom in and out, move it around. And it allows for amazing 3D visualization on a web browser. I can even share my screen and show it to you if you like, so if you want to see it.
We'll include the video
Yeah.
So people will get a chance to see that. So tell me a little bit about the company. I'm assuming you're privately held?
Yes, we're privately held. That's right. Yes.
And have you received funding?
Yes, we have. So So over the years, we've raised a couple rounds of venture funding, and we're actually, probably going to be raising another round maybe later this year. But what we're doing is, yes, so we're privately held, venture funded, and and we've got, some great investors that we love working with. Yes.
And, what is next as far as, are there specific areas that you will focus on when it comes to the modeling?
There are. And what's interesting is one of the exciting things that we're doing, and we really see ourselves as creating an entire ecosystem. And that ecosystem consists of great content like the COVID lung model that we've talked about. The ecosystem also consists of our core med reality platform. And the core med reality platform is the platform that allows us or physicians or really anyone in the world to visualize these 3D medical models across different platforms. So you can visualize the 3D models as we talked about on a web browser. You can visualize the model on an iPhone or Android or in a HoloLens or Oculus. So the core med reality platform is really great because it allows for one model to be distributed across any platform, anywhere in the world, and visualized, in a web with 3D visualization and a, Oculus with VR, or in a HoloLens with AR, or on an iPhone with AR. So all of those things are available as a result of the med reality platform.
So this is a platform as a service play?
Yeah, that's exactly right. It's a platform as a service play. Exactly. And then what we're also doing is we've got some other very cool components that we're creating that plug into the med reality platform, either as input devices or as output devices. And one device that I can talk about is something that we call Med Creator. Now, this is sticking with the med theme. Med Creator is an incredible actual box that is a 3D scanner. And there are lots of 3D scanners out there that people have seen, handheld 3D scanners, or you can even use your iPhone to kind of scan 3D objects. But this box is incredible, and it's really geared towards pathology departments within a hospital. And the box allows you to put in a pathology specimen, so something like an actual heart or an actual brain, and touch one button, and it does a complete 3D scan of that object with multiple cameras in about 1.5 minutes, and that automatically converts that object to a beautiful 3D textured model that then feeds into the med reality system. So you can basically go from an actual physical specimen to a beautiful digital 3D model with one touch. And so it kind of continues to, I guess, show the direction that we're going in, which is providing this suite of solutions that revolve around the med reality platform, that all involve 3D visualization, all involve the digitization of, anatomies to view in 3D, and approach it from different angles and provide different types of solutions and different components that all plug into this main system.
And what about security? Right? Because
Yes.
That's obviously a genuine concern, and this is personal data, private healthcare data.
And that's one of the big things also that's a focus of ours is creating all of this technology, within a HIPAA compliant, secure environment, so that because obviously we're working with data that's originating from patients, and it may just be a patient's heart, and you really can't. There may not be personally identifiable information associated with that heart per se.
Still.
Data associated with it that could be identifiable. So yes. So obviously everything that we're doing, there's a huge focus on security and HIPAA compliance, all that good stuff.
And then what are the expectations as far as where will you go from here?
Yes. No. Perfect. And one of the great things that we're doing is we're starting to work with some great hospitals, some great doctors. to really get the technology out there. And so, a big focus of ours right now is penetration, is working with great folks in the industry, educating them about this technology and getting them started to use the technology, and then working with them to advance their use. And so really our focus is, penetrating the market, education first, penetrating the market, and then scaling them up so they can use this kind of every day. And a big part of our focus also is the ability to use this technology, to use this incredible 3D visualization technology in its various forms, whether it's through the web browser or an iPhone or an Oculus, to allow hospitals and the physicians, the patients, to use this technology today. So, we don't want to sell something that is, 3 years away or 5 years away or 10 years away. We want to sell something that can actually get into people's hands, that they can use this afternoon, and do it in a way where there's incredible use cases, where the technology is immediately available to them, and it can start having an impact right away. And so that, that is a lot of the kind of approach that we're taking in our, ability to educate and penetrate the market. That, look, this is not a future technology. This is something you can start using, in 10 minutes and start to see outcomes right away. And that's one of the things that, really excites us. And utilizing kind of that ability then to grow the use cases and to really kind of get this out there in a massive form.
And also, so in AI, for instance, what we've seen is this has given us insights, which has led to earlier detection or earlier sort of, diagnosis, because we're seeing things a lot earlier based on the insights that are being generated. How do you think this will change healthcare?
I think it'll change dramatically. And I think just as, the perfect example is AI, as you mentioned, where, AI can be used to, spot abnormalities sooner. It can be used to make diagnoses sooner. The ability for 3D visualization, I think, to impact healthcare is incredible. I mean, even beyond what we can imagine now, because, and I'll show you some of the, some more of the future vision. Of course, there is this incredible, immediate, distributed ability, for anyone in the workflow now to visualize what's going on in someone's body, faster, sooner, better than they ever could. And if you extrapolate that out, the ability to then leverage off of that to make faster decisions, to make better decisions, to make decisions that, that save lives, is incredible. But beyond that, the ability then to use the same technology, the same types of 3D anatomical visualizations that we're talking about, and then start to do some even more incredible things, many of which we're working with today, which is the ability to kind of visualize anatomies actually on top of your body. So the ability for you to look in the mirror or for someone to look at you and see your heart properly positioned over your body, and to examine it in the context of, your actual body and all of its surrounding organs, whether that's for, as we've talked about, education or pre-op planning or clinician collaboration, and then the ability to extrapolate that out a little further, and the ability then to have that information provide augmentation to an actual surgery. So before the surgeon even goes in, they can see, where your bodily organ is, see what's going on with your bodily organ, and have that be able to drive improved surgical outcomes. And so the ability to utilize this technology both in the immediate short term, but also in the mid to long term, is going to be incredible, and is really going to, I think, change the way that, healthcare is done on many levels, from as we talked about, clinician collaboration, patient education, pre-op planning in the short term, to, all the longer term implications of actual, surgical augmentation, et cetera.
So in thinking about the COVID lung example, that particular model, that's a static view, correct?
That's correct. Yes, that's a step.
Okay, so do you have, or will you have the ability to show progression?
Yes. So there's, and this is another whole area of study in the sense that there is many amazing ways to show progression through animations, through data that's collected over time, and then digitized into 3D. And so you can see what is effectively a predefined timeline of animation that you can go back and forth and actually understand how those lungs got to be so bad and then how they got better. And that is something that, that's available today and is also the types of things that we're working on. The even kind of more amazing potential kind of future vision is in the ability to create this 4D effect is what I'll call it, which is, 3D visualizations over time. You add the time dimension, so it's now 4D. The real future vision is to be able to provide this kind of 4D visualization, in real time, potentially, based on specific patient circumstances. So, how to capture the data, how to in real time interpret the data and then present the data is something that has, caught the attention of a lot of people and, is a direction that we see all of this going. So yes, there's, I think, multiple levels of showing the progression. The short-term level is capturing and presenting data over time in somewhat of an animated format. And then the longer-term view is how can we capture and present it in effectively real time?
Yeah, I mean, the vision I was just having in my head was, a doctor having, some sort of, glasses where he can see the model, right, while he's working on the patient,
Yeah.
but, and have the model as a reference as well, some sort of smart glasses, Google glasses, or something like that, so that he has the model in front of them to compare to what he's actually seeing in real life.
And I'll tell you, I mean, and those are the types of things we're working on today, because we support some of those right now, including the HoloLens 2. And so with the HoloLens 2, you have this incredible ability to actually be hands-free. You can wear the HoloLens 2, which is basically a set of goggles that allow you that have a see-through, screen built into them. So you can see in front of you the 3D model. It's there in real space, properly sized. You can walk around it. You can reach out with your real hands and touch it and manipulate it, make it bigger, smaller, rotate it, translate it. And when you start to kind of marry that idea with the idea of overlaying that model properly positioned onto someone's actual body, and then having that model effectively be a real-time representation of what's going on inside of their body because you've been able to capture real-time data, then you've got an incredible situation where, the surgeons have a tool at their disposal, which, they could have only dreamed of a few years ago. And so, and that's the direction that all of this is going. So your vision is exactly right, Mike.
Cool. Sometimes I'm paying attention and it works once in a while. So I know you guys are planning to raise some money in the near future. What else is on the roadmap as far as milestones?
Yes, definitely. So, we're growing in a lot of different directions and includes, everything as you can imagine. It includes, growing headcount, growing customers, raising money, and a pretty aggressive product roadmap that allows us to continue to grow kind of the core platform in a lot of amazing ways. And so, and I think like we kind of referred to earlier, we love kind of amazing ourselves. And so, we love kind of, coming up with a roadmap and envisioning where things are going, and then coming up with something that is even more amazing in one way or another. Even something that we thought would be 5 years away, happened in 2 months, which it's happened before, or a technology that we knew would be incredible, but when we see it in action, it even blows us away. And we've seen a lot of that, quite honestly, with some of the body tracking and body overlay things that we were just kind of referring to, where we can overlay an actual physical heart onto you, and those types of things. When you're working in that arena every day, I mean, you look forward to kind of almost every day, because every day holds something that's incredible.
And one last question for you. So you guys are obviously located in Chicago. And we
Yes.
had a little discussion before we started.
Yeah.
Tell me what it's like working, you're not in Silicon Valley, you're not up in Boston. What are the advantages to being in the Midwest?
Well, and it's a great question too, and we talk about it all the time, and it's something, I've been kind of building startups and investing in startups for almost 30 years here in the Midwest. So it's something that I think about a lot. And I think certainly, there are great advantages to being in Northern California and in Silicon Valley, as far as access to resources and access to people and money and great talent, and advantages to being in other various geographic areas. But I've always been partial to the Midwest, and I think there's a lot of also advantage to the Midwest, in the sense that there's it's centrally located within the U.S., which is important, but not so important. But also, I think there's been a growing, especially in the Chicago area, a growing technology community, where and all of the kind of ecosystem around that, as far as wonderfully talented people, as far as access to funding resources, as far as access to companies to work with and partner with, whether they be in healthcare or retail or whatever business you might be in. And so I think there are a lot of advantages to being in the Midwest, especially in the context of kind of the fairly recently growing kind of tech infrastructure and ecosystem. But
there's
I think
some really big healthcare
go ahead.
firms in the Midwest too, right?
Yeah, no, totally. Exactly. And I think one of the interesting things that COVID has done is allow us to come up with, not us, but just everyone to come up with clever ways to, communicate with, your customers, with potential customers, with your employees, with your partners. And in a sense, it's kind of, shrunken the world even more, because it's forced us to really be able to have, discussions that involve, demonstrating products or selling products or developing products, and not necessarily have to kind of, or raise money or whatever your startup is doing, and not necessarily have to be in the same city or the same room. And I think, obviously there's a lot of great advantages to, being in the same room with folks or being in the same city with folks. But I think that, the Midwest has proven to be, I think, able to support and able to help grow some amazing businesses. And I think, when you appreciate all that it has to offer, as does Northern California, as do a lot of other places, you can really take advantage of those assets that it has to offer. So yeah, I think it's been a great place.
I guess the other thing that sort of comes to mind, and if this was a different time, maybe 24 months ago, you would be taking this product to conferences, and you would be doing the circuit, right?
That's exactly right.
How, and that's not currently available to you. There's virtual, but there's very few in-person events.
Yes.
How has that impacted your ability to bring a product to market?
100% it's impacted us. And it's here again, a great question. And we realized early on, especially as COVID was rapidly developing, that, oh my gosh, we have this incredible product that we want to get out there. And of course, as you said, in normal times, we'd be doing the circuit, we'd be going to conferences, we'd be visiting hospitals and physicians and administrators directly and doing live demonstrations and blowing their socks off. And the question was, okay, how in this new world of COVID, can we develop this technology so that it can be demonstrated over the web, so that it can be distributed electronically, so customers can get up and running in minutes and not have to have some type of big physical delivery. And all of those things, really focused our efforts into creating the product that we have today, so that the goal was with MedReality to allow physicians, hospitals, surgeons, radiologists, administrators, allow them to embrace this technology literally in minutes. And how can we do that? And we came up with what I think was a wonderful architecture that allows us to do that, which is, I think you said the great words, kind of this platform as a service, where someone can get up and running within minutes with our technology by simply going to the website, signing up for an account. They automatically have access to all kinds of 3D models they can visualize. They have access to an uploader through the web where they can upload their own models. They can download our iOS app from the iOS App Store, create an account, log in. It all ties together. The app ties with the web, and they have this amazing ability, literally within minutes, to start to, number one, experience this technology in multiple forms, whether it's through a web browser, through AR on an iPhone, and then they could also start to upload their own objects and experience how the technology can be useful for them in their own practice. And all of that without us ever having to visit them, without them ever having to receive a shipment of any kind. Everything can be delivered digitally, electronically, and experienced, nearly immediately.
Oh, cool. Sir, we very much appreciate your time today. It sounds like you guys are doing some really amazing stuff, and we look forward to following you and see what you guys develop down the road. Please stay in touch. And again, thank you for joining us.
Mike, fantastic. Thank you. It was great talking today. Talking more soon.